ABCDE criteria for melanoma detection and early identification. The ABCDE criteria represent a foundational clinical tool for identifying suspicious skin lesions that may indicate melanoma. Healthcare providers and patients use these characteristics to distinguish potentially cancerous growths from benign skin variations. Understanding melanoma and the ABCDE framework. Melanoma represents one of the most serious forms of skin cancer, originating from melanocytes, specialized cells responsible for producing melanin, the pigment that colors our skin. While melanoma most commonly develops on the skin surface, rare occurrences have been documented in mucosal tissues, the gastrointestinal tract, and ocular structures. The stakes of melanoma detection are considerable, as early identification dramatically improves treatment outcomes and survival rates. The ABCDE criteria emerged as a practical, memorable framework that allows both medical professionals and informed patients to recognize potentially dangerous skin lesions before they progress to advanced stages. This systematic approach has become the cornerstone of melanoma screening protocols in dermatological practice and public health education worldwide. The 5 components of the ABCDE criteria. The ABCDE classification system provides 5 distinct warning signs that should prompt medical evaluation when identified on any skin lesion. Each letter represents a specific characteristic that distinguishes potentially malignant growths from the vast majority of benign skin conditions. These criteria were developed through careful observation of melanoma presentations and represent morphological patterns associated with malignant potential. Understanding each component empowers patients and clinicians to make informed decisions about which lesions warrant professional assessment. The system's effectiveness lies partly in its simplicity. It requires no special equipment to apply and can be incorporated into routine self-examination or clinical skin surveys. Asymmetry, the first warning sign. The in ABCDE stands for asymmetry, referring to the uneven distribution of color, shape, or surface characteristics across a lesion. When you mentally divide a suspicious lesion in half along its longest axis, benign moles typically appear roughly identical on both sides. In contrast, melanomas frequently display asymmetrical features where one portion of the lesion differs notably from its counterpart. This asymmetry reflects the chaotic growth patterns characteristic of malignant melanocytes, which lose the organized cellular controls that govern normal skin growth. An asymmetrical lesion does not automatically confirm melanoma. Various benign conditions can appear slightly asymmetrical, but it certainly warrants closer examination and professional evaluation. Patients observing asymmetrical changes in existing moles should schedule appointments with dermatologists for comprehensive assessment. Border irregularity, recognizing abnormal edges. The B in this framework refers to border characteristics, specifically the regularity or irregularity of the lesion's perimeter. Benign nevi typically demonstrate smooth, well-demarcated borders with clear distinction between affected and unaffected skin. Melanomas, by contrast, frequently present with irregular, scalloped, or notched borders where the edge appears to blend into surrounding tissue or shows jagged, asymmetrical outlines. This border irregularity occurs because melanoma cells infiltrate the skin in an uncontrolled manner, lacking the organized arrangement of normal melanocytes. The border may display variations in color distribution or texture, further contributing to its irregular appearance. When examining a lesion for border characteristics, dermatologists look for sharp demarcation versus fuzzy or indistinct boundaries that might suggest active disease. Color variation, multiple hues within one lesion. The C criterion addresses color uniformity within a single lesion. Normal, benign moles characteristically display a single, uniform color throughout, typically tan, brown, or black depending on melanin concentration. Melanomas, conversely, frequently exhibit multiple colors within the same lesion, including shades of brown, black, tan, red, or even blue. This color heterogeneity reflects varying depths of melanin deposition and the presence of different pathological cell populations within the lesion. Some melanomas display an especially concerning pattern of colors, including reddish or whitish areas indicating inflammation or necrosis. The presence of 3 or more distinct colors within a single lesion raises substantial concern for malignancy. However, some non-melanoma conditions can also demonstrate color variation, which is why this criterion functions best when considered alongside the other ABCDE features. Diameter and size considerations. The D stands for diameter, typically referring to lesions measuring greater than 6 mm across. While size alone does not determine malignancy, many benign moles exceed this threshold. Melanomas statistically tend to be larger than their benign counterparts. This criterion serves as a practical screening tool, since lesions approaching or exceeding a pencil eraser's width warrant heightened scrutiny. However, it is crucial to recognize that melanomas can occasionally occur in lesions smaller than 6 mm, and conversely, many benign skin growths exceed this size without presenting any concern. The diameter criterion functions best in conjunction with the other ABCDE features, particularly when increased size accompanies asymmetry, border irregularity, or color variation. Medical professionals increasingly recognize that rapidly enlarging lesions of any size merit evaluation, regardless of their absolute dimensions. Evolution, the critical E component. The E in ABCDE represents evolution, the critical observation that a lesion is changing over time. This component was added to the original criteria later because it proved exceptionally valuable in identifying melanomas. Any skin growth that changes in size, shape, color, or surface texture should trigger medical evaluation. Patients provide invaluable information by describing whether a mole has always looked the same or has undergone transformation. Itching, bleeding, oozing, or other changes in how a lesion feels are additional warning signs encompassed by the evolution criterion. Importantly, most stable lesions that remain unchanged for years are unlikely to be melanomas, whereas actively changing growths demand professional assessment. This criterion emphasizes the importance of patient vigilance and awareness of individual skin characteristics, as changes noticeable to the patient may precede visible changes apparent to casual observation. Application in clinical practice and self-screening. Healthcare providers incorporate the ABCDE criteria into their systematic skin examinations, using these features to prioritize lesions for further investigation through dermoscopy or biopsy. The criteria improve diagnostic consistency among dermatologists and help guide clinical decision-making regarding which lesions require intervention. Beyond professional settings, the ABCDE framework has become central to public health education campaigns encouraging patients to monitor their own skin. Monthly self-examinations using a mirror and natural lighting allow individuals to track existing lesions and identify new growths early. Many dermatology organizations recommend that patients with concerning lesions photograph them to establish baseline documentation and track changes over time. The combination of informed patient awareness and professional medical surveillance represents the most effective approach to melanoma detection. This collaborative model transforms patients into active participants in their own cancer prevention and early detection efforts. Limitations and important qualifications. While the ABCDE criteria serve as valuable screening tools, they possess certain limitations that clinicians must understand. Some melanomas, particularly early-stage lesions or certain subtypes, may not display obvious abnormalities according to these criteria. Conversely, many benign lesions exhibit one or more ABCDE features without representing any malignant threat. The criteria function best as indicators for further evaluation rather than as diagnostic criteria for melanoma itself. Only histopathological examination can confirm malignancy. Additionally, individuals with specific dermatological conditions, such as atypical mole syndrome, may have numerous lesions that partially fit ABCDE criteria, complicating the assessment process. Healthcare providers must consider individual risk factors, including family history of melanoma, sun exposure history, skin phototype, and immunocompromisation status. The ABCDE criteria should be integrated into a comprehensive risk assessment rather than applied rigidly without clinical context. Enhancement through dermoscopy and advanced imaging. While the ABCDE criteria provide excellent guidance for initial lesion assessment, dermatologists frequently supplement this approach with dermoscopy, specialized magnified examination of skin lesions using dedicated handheld instruments. Dermoscopic examination reveals micrometeorological features and patterns not visible to the naked eye, substantially improving diagnostic accuracy. Advanced imaging modalities, including reflectance confocal microscopy and digital dermoscopy, further enhance melanoma detection capabilities in specialized settings. These technologies do not replace the ABCDE criteria but rather complement them by providing additional information to support diagnostic decision-making. For lesions displaying ABCDE features, dermoscopic patterns can strengthen the case for biopsy or increase confidence in observation when clinical suspicion remains low. The integration of clinical assessment, dermoscopic findings, and patient history creates a comprehensive approach to melanoma screening that exceeds what any single methodology can achieve independently. Risk stratification and when to seek professional evaluation. Patients and their families should understand that the presence of ABCDE features indicates the need for professional evaluation, not necessarily a definitive diagnosis of melanoma. Any lesion demonstrating clear asymmetry, irregular borders, multiple colors, significant diameter, or evidence of recent change should be evaluated by a dermatologist without undue delay. Individuals with multiple atypical moles, positive family history of melanoma, or extensive sun exposure history require heightened vigilance and more frequent professional skin examinations. Those with fair skin, light eye color, or tendency toward excessive sun sensitivity face increased melanoma risk and benefit from annual dermatological screening. Risk assessment should drive the frequency of self-examinations and professional evaluations, with higher-risk individuals undergoing more intensive surveillance. Early intervention for concerning lesions identified through ABCDE monitoring has dramatically improved survival outcomes, making public awareness of these criteria an important public health priority. Future perspectives and ongoing research. The ABCDE criteria, while well established and validated, continue to be refined through ongoing clinical research and technological advancement. Investigators are exploring whether additional criteria or modifications might improve sensitivity for detecting melanomas while maintaining acceptable specificity. Digital photography and machine learning algorithms are being developed to assist with longitudinal monitoring of skin lesions by comparing images over time. These technological tools may enhance the evolution criterion's effectiveness by detecting subtle changes that human observation might miss. Additionally, research into biomarkers and genetic signatures of melanoma promises to complement morphological criteria with molecular information for improved risk stratification. The field is moving toward personalized approaches that integrate ABCDE assessment with patient-specific risk factors, dermatoscopic findings, and emerging biomarker data. As these advances develop, the fundamental principles underlying the ABCDE criteria, vigilance, awareness, and evidence-based evaluation, will remain central to melanoma prevention and early detection strategies. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.